All right, everyone. I have on Dr. Morgan MacDermott, and I'm really excited to chat with her. She is a naturopathic doctor, and I've been following her for a while. As a lot of the guests that I bring on, I either find them on Instagram and love their content, and I'm like, hey, you need to come talk to my audience about this. And that's exactly what I did with Dr. Morgan. And then I also had the pleasure of meeting her a couple months ago, which was really exciting. But she just has a passion for women in this phase of life, trying to conceive, pregnancy, birth, motherhood, and just has so many tools in her pocket, being a naturopathic doctor, approaching things from that whole body mindset, and really wanting to help us thrive through this stage of life. So thank you so much for coming on the podcast.
Thank you for having me. This is so awesome. And it was so fun to meet you the other month. When was that? 2 months ago?
Somewhere between there, yeah, around
Yeah.
there. Yeah, so I would love for you to tell us about yourself. What made you get into this line of work in the first place, and to specifically work with women in this season of life?
Yeah. So I thought my entire life I was going to be a veterinarian. I was obsessed with biology and animals. And as a little girl, I had hamsters and betta fish that I bred. So I was always interested in reproduction as well, but in the animal sense. And my mom was a labor and delivery nurse. So like there was always talk of babies, but I really don't remember it being such an influence in my life thinking like, oh, I want to do anything to do with this or have something to do with this with humans. It to me, just up until I was like 20, I was set on being a veterinarian. And so then I kind of got bored of that. Was more interested in the root cause part of health. And at that time, veterinary medicine just didn't really have any aspects of that. It was really just surgery and pharmaceuticals. I didn't know what a naturopathic doctor was. I had never heard of it until I saw an ad. Literally, I mean, this is why ads work. An
Yeah.
ad for Bastyr, which is the medical school that I ended up going to in San Diego, popped up on my computer one day when I was studying in college. And so I changed the direction of my major. I was animal behavior under the biology umbrella. Then I changed it to anatomy and phys and kind of went back off onto the human track of things. And so I knew from the beginning that I had an interest in pregnancy, trying to conceive, preconception, fertility, all of those types of things. But it wasn't until I had my first child in school. I was a third year medical student. Don't really suggest that. But it was a really common thing at the school that I was going to as well. It's like we always used to joke there was something in the water. All these like really healthy naturopathic doctor students kept getting pregnant. And it's also that time of life though. We were all in our late 20s, early 30s. And as a woman trying to go into higher education, it's difficult to try to manage when are you going to do that. So you have to sacrifice something. And I knew having babies was really important to me. So we decided to go for it. I thought it was not going to be as big of a deal as it was. It was very difficult for me. And that's kind of where that passion started. And it's not because of school that it was difficult for me, because I actually took a whole quarter off. So for the first 4 months of my son's life, I had it off. But postpartum just absolutely slapped me in the face. I had no idea the things that could happen, that were going to happen. I didn't know anything about tongue and lip ties, and that ended up being our story. And the resources at that time, this is in 2015, nowadays I feel like it's much more common, and it was on the cusp of becoming more of a common diagnosis, but there was also a lot of denial. And I was just
Mhm.
my nipples were like one had a huge crack in it, and then one of them had a chunk that was missing. And
Oh my
I,
God.
just bleeding and I was so beholden to the idea of breastfeeding, and I had taken off all this time from my school, which was going to shunt me out for another year, which is a huge financial and time decision to make. But I was like, I know how important breast milk is and breastfeeding, and I really, really, really want to do it. I wanted to do it and have that relationship. And I had so many friends who'd gone down that path as well. And I was like, this is such a beautiful thing. I truly feel this in my bones that I meant for this. And watching it almost kind of slip away with that first experience was so devastating to me. So we ended up figuring it out, but it was a really long, painful road for me. And it kind of shunted me into this postpartum anxiety that I had for the first 10 months of his life, which was sad. And it really sucked. And I didn't even know that it was happening. Here I am, a medical student, no clue. First of all, I had not even heard of postpartum anxiety. I think everybody knows about postpartum depression, but
Mhm.
there's a whole slew of postpartum mental health issues that can happen. And I just thought I was being a really good mom, being hyper vigilant. And I felt sort of like, because I had the IBCLC, so the International Board Certified Lactation Consultant community, sort of quote unquote fail me with this lip and tongue tie situation, having it diagnosed very late, or being told that I didn't have enough milk supply when really I was actually an oversupply person, and I continually got mastitis and I couldn't figure out
Mm,
why. And mastitis was way worse than the home birth that I had. I felt like I had to become everything all at once. I had to become like the doctor, the lactation consultant, the everything advocate for him and and it just put me into like a very hypervigilant state where we're really not meant to be all of those things. We should be able to lean on our community and resources for good information. Obviously, it's also really important to be an advocate, and like in some way, we do need to be not relying on other people too much when it comes to our
yeah.
kids, because we have our intuition and things, but I was just like shocked by the whole situation. So after that experience is when my passion for postpartum really grew. And I was always interested in birth. So I planned a home birth, which people thought I was nuts, but like, it just, and it wasn't because I had had any negative experiences from my childhood of hearing my mom talk about hospital birth either. It just was something that I actually found out about in high school. Did not want to be a mom in high school, but I was like, I can't wait to be pregnant and give birth. I was like that one weird girl that I just thought it was so cool. And I didn't have any sisters. I didn't have any cousins around me that were pregnant. I don't know why. It was just something that I think I've always kind of been drawn to and resonated with. I was like, I can't imagine what that's going to feel like to have a baby in my uterus. Like, I want to feel a kick. I want to like know that magic. I think it'll be so cool. So anyways, I think that if things shifted for me from the like preconception, which I do still have a lot of passion about because I think it affects so much, to more of the helping people with the pregnancy, birth, and postpartum thing, I think that that's just really where my heart lies. I like the whole spectrum though, because it's just also important. And then, I mean, now also having 3 kids and being pregnant with the 4th, motherhood topics and parenting and just the challenges of managing life and having realistic expectations of the ways that things will go, generational traumas and reparenting yourself and triggers and
Yeah.
all of that stuff. I love it. I love it all because I'm living it right now. And I'm just like,
Right.
this is all so nuts, you know?
Mm-hmm.
Yeah. So that's a very
Mm-hmm.
long-winded way of how I sort of got to this point. And it's my most favorite thing.
Mm-hmm. Well, I feel like you just even touched on so many things during that because I mean, I went through oral ties with both of my daughters, and nobody in my family that I had known of had ever had a release done or anything like that. And then, you deep dive into different things, and people are like, it's not really a thing. It's like a fad right now. And it's like,
Hmm.
yeah, but you can see it.
Yeah. Yeah. Yeah.
uh, and you could tell the difference, like in my daughter's latch, like before she would have that crease on her lip because she couldn't flange it.
Yep.
And after the release, like it made such a difference. So, um, yeah, it's interesting because you feel like you should be able to lean on your community for support for all different scenarios. And yet you're left to do so much research yourself. And when you're
Yep.
laying in bed in the middle of the night, postpartum, Googling things, that doesn't
It's
help the anxiety. That doesn't
no.
help, and I definitely, again, like went through that with my first, like feeling like I needed to follow these certain schedules, patterns, things instead
Hmm.
of relying on my intuition. And with my second, I was like, she's a baby. She's gonna sleep when she sleeps. Like
I
I
know.
don't I
The
don't know.
blessing of subsequent children. It's honestly, it's like the best thing. I have a lot of friends that are in the first kids
Mm,
realm right now. And whether they had a lot of issue or just a little bit, or if it was smooth sailing for them, I'm like so excited for them to get to the point of having that second child because it's so healing, I think,
mhm,
unless, maybe there's some kind of other further complication, but a
right.
seasoned mom experience, like my second postpartum was so different and blissful. And I just didn't have all that anxiety because I knew like, it's going to be okay. It's going to be okay. But you don't have that lived experience yet first time
Right.
around. And it's just, everything is like, what's going on?
Right. Well, because I think also with your first, like, you're like, how come nobody told me all these different things? But there's
Yeah.
really like no way to describe it. It's like I can
Yes.
tell you this might be hard. You might struggle with this or that. But until you're going through it, you're like, "Oh,
Yeah.
snap." That's what
Exactly.
it is. But yeah, it definitely I always say also, like, parenting's a trip, that whole, like, generational trauma thing and trying to heal things so that hopefully my kids don't have to like deal with it. It's like this like
Yes.
stage is so, it can be so much, but I think that, you know, that mommy culture sometimes just has like such a negative light. And I've been like trying to really look at things positively instead of like, this is so hard. This is so hard. This is, you know, it's like, okay, this is also the path that like I've chosen. And like, you know, like trying to be shifting into this positive light of like, wow, I get to help raise these little creatures and guide them and hopefully let them step into who they are fully and help them like break down things in their own life. And maybe in 20 years, they'll be in therapy about me. Like, who knows?
I know. I know, it's so true. There's some kind of like tenet that they say that no matter what you do, you're going to somehow have a negative impact on your children. And it's not, I mean, amongst all of the positive as well, there will be something that they have to sort of like rethink and heal from. And
Yeah.
that's okay. You know, it's not totally the goal isn't totally to be completely perfect. It's just not possible. But yeah, like I say, there's no better self-development catalyst than parenting, than having
Right.
children and parenting. Like it is so profound and
Yeah.
powerful. And it is really tiring. And I think it's okay for us to have the bad days. But like you said, I'm also in that realm. Like, I really want people to feel like this is such an amazing opportunity that we get to do this and we get to experience this. And as women, like making the babies in our bodies and birthing them and feeding them and having that connected intuition with them, like where you know exactly how they feel even before they can talk or even when they can't, you just get those feelings, you know, it's so cool. And I wasn't somebody who was like an intuitive person before I had kids. And now my intuition has been honed in such a way, specifically with the kids. I would say like other aspects of my life, it's maybe still not as much as other people that I know, but with my kids, like I know what's going on and it's such a deep, there's no questioning it. My monkey mind, you know, I tend to be very like cognitive and be thinking and overanalyzing all the time. No, there's none of that when it comes to the kids. It's like, no, this is what's happening. I know exactly what's happening. I'm going to do this and it's going to make it better. And then it happens. Or I'll wake up moments before they wake up. Or you know what I mean? Just it's that amazing. Their cells are in our bodies forever. We
Hmm.
actually, that microchimerism, I don't know if your audience is familiar, but it's the idea that like when a woman is pregnant with a baby, a fetus, and up until if she's pregnant for the baby up for like 7 weeks. So very, very early miscarriages may not have the fetal cells anymore. But if you've carried a baby to 7 weeks and beyond, you will for the rest of your life carry the fetal cells in your bloodstream. It's somewhere they think between like 1 and 1,000 cells. So it's not a ton. And they present us stem cells, but they will be there. And the way that they found this was because they were finding, this is kind of sad, but it has, you know, research is research, but they were finding in these women who had died during childbirth, um, Y chromosomes in all of their tissues if they had carried male babies. And they were like, what
Mm.
is going on? Why there should not be male chromosomes? You know, and then they traced the DNA back. It was actually of their son. It wasn't just like some random something else or from their father or whatever. And anyway, I just think that that's so profound that
Yeah.
we, no matter what, we will always carry them in us. And like, who knows, maybe there's little electromagnetic frequencies that are passed between the cells that are connecting our souls in this sort of a deeper way. It's all very magical to me. And like, of course, I have a lot of having 3 little kids and then now being really pregnant with a fourth. Like, I definitely have my bad days where I'm like, y'all are crazy.
Oh,
and
yeah.
I and I want to just like run away. And that's okay too, because like we have our own max capacity, you know, and it's not meant to just be one person against all the kids or even two people.
Right.
Even two partners raising children is not enough. It's really not
Hmm.
supposed to be that way. And that's another thing actually about my perspective and the way that I came to all of this is I'm like a very my brain orients like I'm like a naturalist, an anthropologist. I just think ecology, that's why I think I love animals so much. Animals and nature because they live within the rules of nature and there's a reason why things have adapted the way that they have and how to become healthy and work in an ecosystem and blah, 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 blah. And humans are really outside of that. You know, like
Hmm.
we have done all these things that are just not in line with the way that we have come from that where we were really thriving when we were in smaller bands and tribes and communities and raising our own food seasonally and migrating around and like doing all these different things that made so much more sense if we think about ourselves as like an animal species. And so I love that aspect of motherhood though, because I feel like it really ties us to a lot of our animalistic roots.
Hmm.
And and being with a baby is like, I always kind of feel just like a little monkey baby or a
Yeah,
little monkey
totally.
mom, and like my little monkey baby. And I just want to like all your instincts come out. You don't want to like lick them and just suck on their cheeks, and just kiss them all day long. And then you nurse them and there's like fluids everywhere. And birth is so very much this way. And I don't know. I think it's like, oh, this is where we've come from. Like, this is the root to which we need to kind of get back to in order to find, I think, that like deep resonance with earth, God, life, like however, whatever you think about, like, this is the way we should be. Shouldn't be on like the, 75th floor of some apartment and never seeing grass, never touching a tree, never like eating a vegetable or whatever it is that we're doing that is causing so much disease and mental unrest as well. I think all these, like a lot of anxiety and depression just comes from taking an animal out of its environment. We know this time and time again when you look at zoo animals, and even if we try to replicate their environment perfectly, it's just not possible. It is
Right.
not possible. They have done studies with like sharks, say. I remember this specifically. This was actually a naturopathic doctor at one of our student conferences. He was a pediatric naturopathic doctor, and he gave this amazing speech that in it, he had all these studies about animals in captivity, specifically one with sharks, where they've tried to replicate exactly what a shark would see. And it's like immediate surroundings. Obviously, it's still in a tank, so it's not as big as the ocean. But the maximum amount of days that the sharks would survive is like 126 or something. And sharks are supposed to live to be like 30, 40, years old. So there was something so very vital that's missing for them. And it's like, I think that when we have the things that are vitally missing for us, we are going to fall into disease and unrest and unhappiness. And in this country, particularly for mothers, we have such a lack of support and a real big issue with that. And one of my personal missions, although I do think there's so much work that can be done in the, how do maternal like laws take place to integrate mothers back into workforce or those kinds of ways. For me, I really want, like we were speaking about in the beginning, is I want women to have more of a base level knowledge of what's to come so that they're not shocked by it, because I hated that feeling of being
Hmm.
shocked. And I really also felt like I was super prepared. And I don't know why
Right.
I felt like that, because I was not. But it's just like, if we're not going to live in these situations where moms and uncles and sisters and best friends are all around us all the time, you get to go and attend births, you know what it's like. You get to see people latching their babies, having struggles, unlatching the baby, putting the baby back on, standing up, walking around, shushing them. Just that little thing to know that that's like normal, that's not, there's nothing wrong with you. There's nothing wrong with your baby. If you have to like unlatch them a couple times and stand up and shush them, and then you'll get them ready. And then they kind of like fall asleep at the, whatever. Just that little microcosm to the macrocosm is so impactful, I think, for people to be like, wow, holy crap, there is a lot to this that I'm just not going to like wig out about if it's not, there's so many ways to fix it and to go about it, but we just don't know because we don't see it until we have our own babies in our arms and we're expected to do it for the first time. And that just crushes my soul because it's so overwhelming. And it can be this amazing, it should be this absolutely incredible experience in our lives. And I feel like because we're so unprepared, there's a lot of confusion, overwhelm, anxiety, and it just is sad because it doesn't need to be that way.
Right. Yeah. I know. I mean, I resonate with that too. I mean, I'm a birth doula. I was a birth doula for how many years before I had my first? 8 years before I
Oh,
had
that's
my
so cool
first. Yeah,
for
and
you.
I was still hit so hard by it. And like, like it still just completely rocked my world. And so much of it was that like not being taught to rely on our intuition, which I think is stripped away from us very early in life. And
Yep.
so it's really hard to come back to that. I mean, if you look at just the medical model now when it comes to pregnancy, um, you're meant to question everything from the beginning. Like you're not validated even in the beginning. They don't see you till you're almost in your second trimester. Like
Oh,
that first trimester, you're left on your own. They're like, okay, we'll see you at 10 weeks. And you're sitting at home like, is everything okay? Is it not? But we've also come to this place where we need that like medical validation to know everything's okay
yep.
versus trying to learn to trust, which with me having previous losses, like that's really hard. Like I really struggle in the beginning. Like with that, I'm like, no, I need to get in there right away and see if
I
there's
need
a
to see a
baby in there.
heartbeat. Yeah.
Right. Um, whereas like our bodies are going to do what they're meant to do. And that can also be really, really tough. Um, because when I was dealing with loss, like my husband, definitely was my rock. And he's like your baby or your body's doing what it's supposed to. Like it wasn't a healthy baby. It wasn't a viable pregnancy. And like to try to like wrap your mind around that, like to still like honor your body for doing what it's supposed to is really, really tough. But again, we're just like so medicalized. So it's like, even for me, I'm like, was my bath too hot? Is that why this happened? Is it because I
Yeah,
had some sushi? Is it because like these different things? And
100%.
I also just recently learned talking to a functional medicine doctor who deals with this. She was like, basically everything that's going into that first trimester is preconceptionally. So it's everything that was done preconceptually that's happening in that first trimester. So if you have a miscarriage at 6 weeks, it's not something you did that week
Right.
to miscarry the baby. It's
Yes.
things, or even just it wasn't a healthy pregnancy. Like it
Yeah.
wasn't a viable pregnancy.
Yep.
So I think we're just kind of stripped of our intuition like so quickly. And then in pregnancy, telling you like your baby's too big, your pelvis is too small. We need like, all these different things instead of you tapping in and trying and being supported medically through that. It just doesn't happen here. So, how are you supposed to enter motherhood being tapped in when you've been made to question your body? I mean, even from the time I received zero sex education growing up. I'm like, I can get
Yep.
pregnant any day of the month. I, you don't know anything. So I'm made to question my body from the
Mhm.
beginning. Like, you know, is this normal? Is it not? We're told that heavy periods, PMS, all these things are normal. They're not, they're
Yep.
common, right?
Mhm.
So we're just like not set up to trust in
No.
ourselves, in our bodies. So how do you even go into birth and postpartum, like trusting yourself when we've never been taught or even shown by the previous generation? Some people were, some were not. I think my mom had inductions for all four babies. She had them all unmedicated, but she did what her doctor told her to because that's what you do. And
Right.
so um it's it's like
I
how do
think
you start to trust?
totally. I think the people around us have such a big impact, and that's like a it's not one of the main tips that I was going to talk about today, but now it is that surround yourself with other women who love motherhood and who've loved birth and who have maybe gone a different route and learn from them. I remember really explicitly this one friend that I had in medical school who ended up being like a sort of doula figure for me in that first birth, who had had a planned free birth. And I'd never even heard of that. And it was with
Yeah.
her first child. And I was like, what are you talking about? Like, why would you? I thought I was being radical having a home birth, but I also felt so safe with the midwife. So I was like, at least I have somebody there. You are just gonna have your husband there. Like, why? And it was like an uncomfortable thought experiment for me for years. And
Yeah.
she's just one of those pioneer type people. Everything she does, she's several years ahead of the curve. And I have learned so much from her confidence and her community and the resources that she's shared and just the way that she makes me think about stuff and question things and go, "Oh my god, you know what? You're actually right. Like this is wow, that is amazing." And of course it's not for everybody, but just the idea that our societal depictions of birth, postpartum motherhood are mommy wine culture
Hmm.
and screaming in with your legs in the stirrups like Katherine Heigl in that whatever that movie is. And it's not in line with happy things. And this is, you guys, for any of you who don't have kids yet, it is the coolest thing, is it not? It is the
Yeah.
coolest. And it's
Hmm.
like, it's almost addicting. Like I'm on number 4. What the heck? Like nobody has 4 kids in 2023. You know what I mean? But it is amazing. It's so empowering. It's so connecting. It's the deepest love. I mean, some of the highest highs and the lowest lows, of course, because when you blast yourself open to being vulnerable to this type of high love feeling, there is going to be lows, of course, with it. It's the dualistic nature of life. And we have to be okay with that and know that we're going to like come out on the other side, get some support, of course. But like, it's incredible. And I would never, ever, ever take it back for anything. But I know that there's people who are scared about the whole thing because they see what's happening in society to other people who are just complaining about it, or they're struggling, or they don't have any resources and they don't trust themselves, and everything is wigged out to their deepest core cellular level. They don't have any true north direction. And I feel like becoming a mother solidifies the true north direction for so many women, because you're like, yep, this is it. And like to go through that birth experience and to come out the other side and be like, wow, I did that, is, I think, a very preparatory and intentional aspect of the way that we enter parenthood, so that we know we can do hard things. And when
Right.
stuff gets really gnarly, we can do it and we're going to be okay. And we are like the power center and the nervous system of this entire family unit. And like how much privilege, opportunity, and power that there is in that. And it's being stripped away like constantly. And it just infuriates me.
Mm-hmm. Yeah, absolutely. Before we dive into like some of the tips that you have for us, we never
Yeah.
like fully touched on what a naturopathic doctor
Oh
is.
yeah.
Just because, some people might be like, okay, so you're like a chiropractor, you're like you know
Yes.
what I mean? Like,
Yep.
I think people might not
I don't
think that
know.
you're a real doctor.
Yeah. No, I absolutely get that. So I was explaining this to patients yesterday because I worked in the office that I work at here in Idaho. So okay, naturopathic doctor goes to college, a 4-year undergrad, then they go to a 4-year medical school. When we graduate, we're considered primary care physicians. So there is some residencies if you want to go into a specific track, like there's oncology residencies for cancer, integrated cancer treatment, or there's a pediatric one. There's very few and far between, and they're not necessary. So medical doctors, MDs, go to their 4-year general education, and then they go on to a residency to become some sort of specialized something. Naturopathic doctors we graduate as primary care. So our root goal is to get to the root cause of your issue. We use integrative therapies. We can use pharmaceuticals. So we get all of the same training in pharmaceuticals that a medical doctor does. A lot of people don't know that. And
Hmm.
we don't really use them because we don't really kind of want to. That's not that we do if we have to. Like, of course,
Yeah.
antibiotics, and there's different things so I see pediatrics in the practice that I work at here. So antibiotics are really the only thing that I've really tapped into. I'm trying to think if there's anything else, but that one there's a time and place,
Right.
and there's a time and place for a lot of other medications, but or thyroid meds, et cetera. Anyway, but then we also, in addition to that, we learn everything about herbs, homeopathics, physical medicine, lifestyle medicine, nutrition, deep, deep, deep dive into nutrition. So it's a very comprehensive, it's a lot. It is a lot in 4 years. The amount of information and knowledge that we are meant to be responsible for is intense. And then we do take 2 sets of board licensing exams. And depending on the state that you live in, we are either licensed or not. So there's several states that are still not licensed. What that means is that you can practice still there, but you can't call yourself a naturopathic doctor. You can maybe just call yourself some sort of like health kind of coach or something like that. In Idaho, we are licensed. So technically, actually, my license name is under naturopathic medical doctor here, because there was for a very long time naturopathic doctor in the legislature, which was able to be used by anybody who had done any kind of
Hmm.
anything. You could move here and call yourself a naturopathic doctor in Idaho. So in order to make ourselves distinguished, that we have gone to an accredited 4-year medical college that is, and we hold a current license. We go by either naturopathic medical doctor or naturopathic physician. Each state has a little bit of different laws, a little bit of a different scope. It's awesome. I mean, I love it. And then a lot of people will become naturopathic doctors and then sometimes go on and do additional like functional medicine trainings at the Functional Medicine Institute. But I
Hmm.
would say that, so the Functional Medicine Institute was originally created to train medical doctors and chiropractors to become more kind of thorough with the way that they're thinking about things, because they have this really big opportunity to touch people in a deep way and to get to the root cause of things, where that is the way that we are trained from day one. So there's not a lot that I would say is additional learning when a naturopathic doctor goes to the Functional Medicine of Idaho, or I mean, sorry, Functional Medicine Institute. There is a Functional Medicine of Idaho. That's why I said that. Sorry. But it's something that you might see. You might see people kind of dual calling themselves that, because a lot of people do know the term functional medicine doctor.
Yeah.
But naturopathic doctor is a little bit wishy-washy. They're like, are you a homeopath? It's like, well, I do homeopathy. Homeopathy is like saying herbal medicine. It is one type of track of modality that I can use to help somebody. But we're much more than, just sort of one of those, like an herbalist or something like that. But yeah, anyways, it's awesome. It's so fun.
Yeah. Well, I'm wondering if Illinois is one of the states that you can't license in, because I've tried looking up a naturopathic doctor here and there's like
Yeah.
none. So I'm
Let me
like,
look it up here real quick.
maybe there's nothing here for me, because it's been really hard trying to find we don't have like a family physician, like, which I didn't go to a doctor for 15 years of my life. I don't necessarily feel like I need one, but like, I'm like, I don't feel like we have like, if we
They
do
are,
need something.
yeah. So it says naturopathic doctors are not currently licensed in the state of Illinois. That's wild. Bills have been introduced to the state legislature that provide nomenclature to licensed naturopathic doctors, but professional licensure is necessary to ensure that the public has access to properly trained and educated naturopathic doctors, and they're not yet. So the current states that don't have it,
Of course,
let's
the
see,
Illinois
on
one.
yeah. Well, so it says that 2023. I mean, there's so many states that are always like in the current, it's always a bill that's happening. And the people there are working very, very hard to try to get it. But like some that don't have any kind of bills that are going on, just to name a few, like Nevada, South Dakota, Nebraska, Louisiana, Alabama, Kentucky, South Carolina, they have like no movement going on. Illinois and New York are two, and North Carolina are three actually, that have, seems like, trying really, really hard, but not quite there yet. So, I mean,
Yeah.
it's always changing.
Yeah. But that's also why I said, like, of course not Illinois, because like, um, you can't practice as like a home birth midwife here if you're a certified midwife.
No, stop it.
Yeah, you have to be a certified nurse midwife. You have to be a
Oh,
CNM.
got it.
Um, but but if I drive up to Wisconsin or down to Indiana, I can. There's a lot of laws surrounding birth here, even on like the birthing center that I go to. Like, it's definitely restricted on a lot of things due to like state laws, like that risk you out of care there. Um, so I know that by
Frustrating.
the end of the year, CM should be able to do home births. Like, I know that there's a midwife here who's been practicing for 40 years and everybody loves her. She's technically illegal, like, and
Gosh,
could lose her license, which is ridiculous.
ridiculous. Yep.
So, that's why I'm like, of course, like I have to like, I mean, in Indiana's an hour away, Wisconsin's an hour away. So I told my
Yeah,
husband, I'm like, if I end up having a breech birth, like
we're
nobody
driving.
here, right? Yeah, we're driving, or I guess there's like some lady in Indiana you can like pay to come deliver it, but
Yeah.
it's just like, so you're just so limited on options
Yeah.
in certain
Yeah.
places. But I would love to know, as a naturopathic doctor, taking a different approach, because we know that that's like such a huge gap in care when it comes to pregnancy, birth, postpartum. Postpartum, you're given zero nutritional information. You're given
No.
like just nothing
Mhm.
besides, you know, when,
Come back at
like,
6 weeks and then you can have sex again.
right, exactly. It's like, okay, you're going to bleed, you're going to do this, you're going to do that. Try not to
Yep.
do these things. That's it. There's
Yep.
nothing to support you hormonally, mentally, nutritionally. And same with birth. Like, we know that there's things you can do to help have better birthing outcomes, yet we're given zero of that information by the obstetric system. So, as a naturopathic doctor, what would be like a few tips that you like to give to your followers or like people who work with you when it comes to birth and postpartum?
Yes, absolutely. Great questions. So let's start with birth. So if I had to come up with some top birth tips, the first thing, and this is something I've learned as the importance more recently, is the baby's position during birth, which as a doula, you obviously know this. I, if you're familiar or if your audience is familiar with Anne Gilligan, she created this algorithm called Gilligan's Guide. She has been a labor and delivery nurse for 100 years and
Yeah.
is absolutely amazing. She's amazing. She teaches courses to doulas and then also medical professionals, or you can, if you are pregnant, you can do a consult with her and she can teach you her guide, which basically teaches you how to rotate a baby into the best optimal position, which is where their back is on the left-hand side of your uterus when you're going into labor. Up until the point of labor, it doesn't matter as much. I mean, obviously, head down would be best. And maybe if the baby can be encouraged to stay on the left-hand side, but they move around and that's okay. But once you're in labor, the goal is to have the baby on the left-hand side of the back. And I kind of knew that there was more room of the in the uterus on the left-hand side due to the liver being on the right-hand side of the body. So it pushes down, it creates a little bit less space there. But I also did not know, and I learned from Anne recently, that the contractile pattern of the muscles of the uterus they're not just completely like squeezed down evenly in a
Right.
tube. It has a little bit of a rotation,
Mhm.
has a little bit of like a corkscrewing, like you're sort of screwing it or threading the baby down like a screw in a bolt nut thing, whatever. I don't know the terms, the hole that you're putting the screw in.
Yeah.
And so the uterus is, and the anatomically, our bodies are really trying to get the baby into this left hand side. It's called LOA, so left occiput anterior. But I'm just going to talk about the back, meaning that like the baby's back is on your left hand side. And because I feel like it's easier for people to think about rather than occiput, which is the back of the
Yeah.
head. But anyways, so I was absolutely mind blown by her course. I knew that it was important, but I just didn't realize how important. And in her course, she teaches you how, based on maternal positioning, so like different positions that the mom does during contractions or in between contractions, that this particular flow, and it's the set of 4 movements that she has nailed down and she has practiced in a huge hospital and, you know, hundreds and hundreds of babies. And she has like a 95%. She's done like a couple of little small studies within the hospital of women who've done her guide in birth. And she's had like 1 cesarean or maybe 0, 1 or 0 cesareans in years now. Um, because she's gotten the baby in the right position, and our bodies are meant to flow with birth. And if the baby is in the right position, so many things go much easier.
Yeah.
People might be asking, well, why does it matter? And it's like, okay, well, let's start out. If the baby starts out on the right hand side of the body, that their inherent movements, so they're called the cardinal movements, the baby is actually very active in birth. They're not just passively being squeezed. They are rotating, they're doing things. And typically the first rotation that they make, if their body is on the right hand side, they will flip posterior. That
Yeah.
means that like they're sunny side up. And
Describing
posterior,
my first birth.
yeah, yep, yeah, I know, me too. Me too. My baby was on the right and I didn't know. I was just like, okay,
Yeah.
whatever. Like I figured. And then it was like, as a first birth, particularly, women are at the most risk for this
Yep.
because there's so much less room in the shape of the uterus. So, like a subsequent pregnancy mom, the uterus is shaped larger at the bottom. It's more like bulbous at the bottom, where the first time around, it hasn't been stretched. I mean, it just makes sense, right? Like, it's just not as big, it's not as roomy for the baby to make some kind of adjustments now after being crammed into the pelvis for hours. But as a subsequent time mom, you do have a little bit more wiggle room. Anyway, and so then it's easier to encourage baby into that proper positioning. But her guide is like, it's not difficult. Anyone could do this. She even gives you adjustments for if somebody has an epidural. I just think it's so brilliant. So looking into that and knowing and maybe talking with your doula, midwife, OB, whoever it is, to be really advocating, can you maybe palpate my belly? Or, you know, a lot of the time Anne always encourages moms to like figure it out for themselves. Where's your baby? She always asks, she said she always asks moms, where's your baby's back right now? And that
Mm.
9 times out of 10, the women are right. They know, they just intuitively know, they can feel around and they know on their bodies. And if baby's back is on the right, we can do some things to change it. And this is going to make our labors go much faster, much less
Yeah.
painful,
Mm-hmm.
and just be more in line with a normal progression of birth, which is cervical change that's happening regularly. You know, these contractions are effective because the right part of the baby's head is on the cervix. The baby's head is not asynclitic. Asynclitic means that they are kind of crushing into your your
Okay.
hip, or their head is like off to the side and tilted. We really need the top of the back of the head sitting right on top of the cervix to put the most pressure, to really get it open so that these contractions are effective. And then birth is not this 4-day long event that's all in your back and you're completely exhausted. And anyway, that I think it's coming into the forefront of my mind of like, wow, holy crap, this is way more important than
Yeah.
I thought. So
Yeah.
yeah, I would definitely encourage people to look into that. And, you know, in terms of spinning babies and things to do prenatally, her take on that is that spinning babies, and I do agree with this, spinning babies is not appropriate for all women. If you have high blood pressure, doing inversions and things like that, it's not okay. It's not indicated. And that prenatally, really, the best thing that we can be doing is just getting up and being active and moving around. So, like, she has this homework guide after 34 weeks that you can be doing some things to like stretch, you know, stretching up in your rib cage, making sure some room, lifting your arms up. I wouldn't have thought that that would really matter all that much, excuse me, but it does, creating that space between your hip and your bottom rib. And then when you're sitting, like a lot of us are, because we're working or we're doing whatever, to get up like every hour and walk around for 90 seconds, you know, put an alarm on your phone, like try not to be sitting still sedentary for hours and hours, because that is what is encouraging babies to be more on the right hand side. So that, I don't know, as a doula, I'm sure you've had a lot of experience with this, but I just was mind blown.
Yeah, I actually haven't taken her course and I need to. All of that was my first birth. And I
Yeah.
did the spinning babies things leading up to it to try to make sure, because I know how important it is for baby to be in the right position. Because as you mentioned, like research even shows a baby in the proper position, it's a shorter labor and less painful. And which, I mean, when you compare my first and my second was in the perfect position. And holy crap, like
Yep.
I've said it on here a bunch of times, like when I was pushing her out, it was less painful than when I was 5 centimeters dilated with my first.
Yep.
Because my first was sunny side up. She was asynclitic. She was everything.
All the things.
Yeah. And we, my doula had me doing like everything. But I don't know if she was doing this. So like I need to learn more about that, because you can tell, like you can even tell when you're out of labor. Because if you think about it, if the baby's in the perfect position, they're corkscrewing, like you said, just right down. If they're in the wrong position, it's going to take more time
It takes so much more time.
for
It's
them to
harder for
get
them to navigate
right.
it. Yes, they
Right,
can't do
totally.
it.
And then you can even see the labor stalls because their
Mhm.
head's not pushing right there. So then the baby's the contractions are still working, even if you're not dilating. They're
Yeah, they're still
trying to get
doing
the
things. They're trying. Yeah.
right. But that's like when it is so quick for OBs to call failure to progress
Mhm.
versus failure to wait, to let your baby work this
Yeah.
out, your body and your baby to really get them in the right position. So it is huge. I'm so glad that you talked about this. I need to take her course. I've heard about her before, but I haven't really looked into her. But I wrote down her name and I'm like, oh my gosh, I need
You
to
will be
take
mind
this.
blown. Please call me immediately after you talk to talk to her, because I was just like, dang. And about the four movements, it's not fair for me to explain them here, so I'm not going
Right.
to, but
Yeah.
they are, so yes, we know of other movements that we can do in birth that would like help encourage, but the way that she has thought about this methodically in her mind, she's very much a scientist, is okay, what do we need to do? She's just thought about it in this way that is very, very, very successful. And she's edited it, changed it over the years as she's had hundreds of babies of experience to practice, and women to practice this on. And it's like this whole thing of, okay, we really want to like make room for them to become directly up and down so they're not acyclitic. And then we need to chin tuck. So then how do we get the baby to chin tuck? And then we need the baby to want to move over onto the left hand side of the body. So it's very methodical. And I'm just like, how in the world? I honestly think it's the kind of information that is going to revolutionize birth. And in the future, I would hope to God it'll be something everyone takes. It'll be something everyone knows about and they go, "Oh, do Gilligan's Guide." Just like, whatever the pose is called for shoulder dystocia, like the Ina May Gaskin thing, or how there's like names. There's
Yeah.
like
Yeah. Yeah.
Walter's position and Walker
Vultures.
and
Yeah.
yeah, or like Leopold's, I don't know, for like
Hmm.
palpation, different names. I think Gilligan is going to be one of those in the future.
Yeah.
Mark my words. We'll see.
Yeah. Well, it is very important, like you said, and it makes such a huge difference. And I think maybe it's more common in first babies too, because we have more time to sit and relax. Like
Yeah,
in your second
totally
and
good
third
point.
baby. Because when you're like, try not to sit down, I'm like, literally me podcasting is like when I sit down. I feel like I'm always on my feet. My kids always want snacks, and then you're picking up, and then you're doing this, and then you're doing that. It's like, I don't have time to just sit down. And
It's
if I do,
such a
I'm
good
like
point.
doing a little bit of computer work, and then somebody's screaming. You know what I mean? It's like,
Yep.
you don't have time to relax. So you're,
It's so true, but
I
it's
think
better. It is better
right.
for us. It's harder. I mean, definitely first pregnancy. It's like, yep, get your nap in, do your thing, but also be up and walking and moving around for sure.
Right, right. Yeah, thank you for that.
Okay,
I've
so
heard, like I said,
yeah.
I heard about her, so now I'm like, okay, I got to do it.
Yeah, here's your second push. Here's your sign.
Yes.
Okay, so number 2, my another top tip, and this is like more of a doula tip, so that you probably will, actually my next 2 are kind of more like doula tips, but to just the idea of laying in bed as long as you absolutely can. So, and what this really means is that whatever the time of day it is, I just feel like, especially with first births, as you've probably seen time and time again, it's so easy to get very excited and to think, I'm going to go on a walk, I'm going to get things going. Oh, when I'm up and around, the contractions feel a little bit more intense, and it's like very early labor. And if we had a crystal ball and we could see how long things might take, I think a lot of women would make a different choice and they would rest as
Yeah.
much as they possibly can. So literally what I mean by that is lay down in bed, stick a gajillion pillows between your legs, keep your pelvis very open, and rest. You may not fall asleep, but you are still resting. You are conserving energy. Like when a hummingbird lands on a branch and they go into it's called torpor. It's not hibernation, but it's almost like hibernation. Their bodies, like their metabolism is so fast when they're flying around because their wings are going so fast. And to find nectar from flower to flower, they're like almost bringing their body to the brink of exhaustion every time. So when they land on a branch, they go into this kind of like immediate quick shutdown of all their physiological processes. So they just are like using the very least amount of energy as possible. I want all my mamas to go and be in torpor in the bed, like
Yeah.
just rest. I don't care if the
Yep.
contractions are 15 minutes apart, maybe put on like a podcast, an audiobook, music, zone out, whatever. You might actually fall asleep. And those little few minutes of sleep are precious to the grand scheme of things. When you feel a contraction, if it's intense, like shake your leg, rock around. If you have to get up on hands and knees or something like that, then do it. And then immediately, as soon as it's done, plop back down and stay in that kind of a like zone, and then switching right side, left side every probably like hour, but stay in that mindset that I'm going to rest until you absolutely literally cannot anymore.
Right.
Because as things progress, there will come a time where you cannot. And if you think it's now and you're not quite sure, then you're not there yet. You need to wait until you're like, oh
Right.
my God, this is so intense. I have to be up. I have to be swaying and moaning and working my way through. Or they're so frequent, they're every 2 or 3 minutes that like it's unreasonable to be laying down anymore. Wait until you are in that point. That is just, I think, such an important mindset of wrapping ourselves around like what the intent. And it's hard when you don't know and you've not had given birth yet, but you will get to a point where you are beyond your skin. You're like, I can't even contain this anymore. And not to scare you, I'm just trying to be realistic. It is that way. And it's the most powerful, amazing thing I've ever felt. I'm obsessed. I love it. Maybe in the very throes of transition, I don't love it, but like I keep doing it. So anyway, that I think is huge. If people just knew
Hmm.
how important the rest was, so
Right.
much about first time labors would be different.
Oh, 100%. And again, it's a mistake I made with my first, even though I give
Me
this
too.
advice to people as a doula.
I know.
I'm like, honestly, I should have popped a Benadryl and went back to sleep for
Hmm.
as long as I could.
Yep.
And I went to the hospital 10 hours before I should have.
Yeah.
And and that's also where unnecessary intervention happens. It's where your body stalls because you've changed environment. Like so many things happen when you're getting to the hospital too quickly. Even if you are desiring to have an epidural, you get that too soon. You like there's so many things that can happen. Like I said, I always tell people call me first
Yep.
before you call your doctor or whatever. And we'll talk about it. Like, because even if your water's broken, you can still labor safely at home.
Yes.
And so there's so many, that's like such amazing advice. Again, like I always tell people that too. Like I just
I
over the weekend
know.
had a friend texting me and or her mom was, well, her mom was texting her mom who was texting her mom was texting my mom who was texting me.
Oh,
And she's
nice.
like, okay, this is going on. And I'm like, nope, not yet.
I
They're like, they're
know.
getting worried that she needs to go right now. And I'm like, nope, not yet. Like,
No, I know. It's really hard. It's just this like balance of you think I remember with my first being like, oh, things are getting like, I don't know. I popped up out of bed at like 4 in the morning because they were every 5 minutes, but I was like, they were literally a 1 out of 10 in intensity of what was to
right,
come, but you just don't
totally.
know. So
Right.
anyway, if I can just like really press upon people, just
Yeah.
stay in bed until you absolutely can. So
Well, and I think
that's
the adrenaline of the first one though,
yes,
like
it's so
is like it's
exciting.
hard to rest because you're like, it's happening, like what's
Yeah,
like you're excited. But and I've only known a couple of people where the precipitous labor has happened, where it's like
same.
that. And again, and you'll know like
Yeah.
it's
Yep.
happening. But yeah, those beginning early labor should really be at home.
Yep, and it could be days. So just wrap your mind around it
Right,
be a couple
totally.
days.
Right, totally.
And if it's anything shorter, then you'll be pleasantly surprised.
Right, exactly.
Okay, and number 3, I would say is the mindset idea of fully, I don't know, I mean, this is gonna be dependent upon every individual woman and their beliefs and what's happening and how they feel, but I think if we can just wrap our minds around the idea that the pain is not gonna kill us, it will be over at some point. And to fully deeply surrender to it and not trying
Yeah.
to like run away, not trying to abate the pain, taking different things, even if it's natural stuff, herbs, homeopathy, et cetera, in the beginning of labor, to be like, what's going to help with reducing the pain. It's like, you just have to let it crash over you. And I am not somebody who thinks that birth is painless. I do know that there's people out there. I'm
Yeah.
not one of those people.
Yeah.
And I think that most people aren't. So it's like, let's just be real with it. But you guys, it's not broken bone pain. It's not like it's really, really, really intense. But guess what makes it less intense? When you are relaxed and you are totally surrendered to it. So I was just in Hawaii. We were jumping around in the waves. It was absolutely amazing. And it's something that I used to do in San Diego all the time when I was there for medical school. Like, how you get past like when you're at the break point of the waves at the ocean, it's so hard. When you're like right where they're toppling over and you're trying to get through into that deeper water, it's like every wave is just like really harsh and it's like falling on you and you're like, oh my gosh. But then as soon as you can get past that and you get out to the deeper water where you can like jump up over the wave, or like if it's too big, you just kind of go through it and you hold your breath and you like let it wash over you and then you come back up and you're just flowing with the ocean in this very different way. But when you're at that point still where the waves are breaking on top of each other, I feel like a lot of people stay in that kind of a resisted mindset during birth, and they are just trying to like fight it. They're trying to fight it. They're like tense. They're not letting their brains become beautifully drugged by the orchestra of hormones and endorphins and things that are happening in your body physiologically for your benefit, when we can just completely let go and give in and allow the waves to crash over your head. Like, just allow it to happen and know that it's a blip in time. You're just a human body having a human experience. You will be okay. And you will actually be more than okay at the end, because you're going to be so freaking proud of yourself. And it's such an amazing experience to have. And I especially, to me, I don't know about you and what you've experienced as a doula, but I think that there's something about the transition between early and active labor that's particularly hard.
Oh,
Because
totally.
yeah, like what is that? It's almost like, yeah, of course transition is very hard as well, but there's that cusp before people, because I feel like people they try to hold on, and it's like,
Hmm.
just let it go. Just let it go. Be in active labor. Just find your groove. Stop talking in between contractions. Stop looking outside yourself. Close your damn eyes. Put some music on and just forget about everything that's going on. Like, you're not in this room anymore. Like, let your brain drop into that different brainwave state that we know that it does in labor, and like
Yeah.
stay there. It's a psychedelic experience. You are drugged, but if you are resisting, it won't happen as well and you're just going to be in pain. Like, really let it happen. I don't know how else to explain it, but I try to explain this to my friends and clients, friends and patients and things, that the sooner, and it's an analogy for motherhood. The sooner that you can like surrender to the fact that motherhood is also going to be really wild,
Right.
and that you can't control your kids. You really just can't. You are working in this relationship together with them. And yes, you're the parent, you're still the authority figure, et cetera, et cetera. And you cannot control them. So if you think that you're going to crush them in a box, or you think that you're going to run away from your labor pain, you're just sadly mistaken. And at some point you're either going to realize it and give in, or you're just going to hate the entire thing.
Right. Right. Yeah. Yeah. I mean, we're even taught like during that phase, that's usually when most people who, let's say they're planning an unmedicated birth, are like, nope, I want the epidural. Nope, I'm done. I can't do this anymore. But then once you get past that and you enter this rhythmic state,
Yes.
you're just like in it. Like
Yep.
you can't, you can't like get out of it. You're in it. You're just flowing through it. You're in some sort of rhythm. That's definitely, you see the switch though of that. We're also taught that in doula training, from outward to inward, like where they are talking between the contractions and all of a sudden they're completely
Different.
turned inwards. And that's
Yep.
also where it's nice to have a doula or some sort of support person there to help control your environment, because like
Yep.
I've been at births where they're in that inward movement and people are like, oh yeah, did you see the football game? Da, 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 da. And it's like,
Oh,
shut up.
yep.
Like you need to be supported in that moment to have that. And that's why environment matters too. Like if you're having a hospital birth, take LED candles with you. You have soft music, turn on the lights, get these candles going, bring your pillow from home, like make it as comfortable of an environment as possible so that you can let your body relax, go inward, and it doesn't seem like this like sterile medical
Yeah,
event. But yeah, we definitely see that switch.
totally. And it's wonderful when it happens, because you're like, okay, like they did it. Good job. Like you're in it.
Yeah.
Now you're chugging along, and now you're on this train that can't stop. But there
Right.
is that early period where that's when things can get really screwed up and labor can stall because of the mental emotional stress and all sorts of stuff. So that's kind of my third tip. My fourth tip, I would say, and I just saw a cool post about this. I was trying to find it to find the studies. If I can, I'll send them to you. But electrolytes in
Mhm.
labor, right? Okay, so we know that that would be important in eating and all of that kind of stuff, but specifically consuming an electrolyte that has calcium carbonate in it. So I really like the Redmond's Real Salt Relight,
Mhm. Hmm.
Relyte. So they make a few different versions of that um, electrolyte powder. So they make one that's like a pre-workout or a boost that has some caffeine and stuff. I would just get the regular plain Redmond's Relight. It doesn't have a ton of calcium carbonate, but a lot of the other ones just don't have it at all. Element has no calcium carbonate, Needed has no calcium carbonate. But the calcium carbonate specifically, there is new research that the women who've contained or consumed it during labor have shorter, faster, easier labors. And it has to do with the way that the muscle contracts and what muscles need. Muscles need there's a calcium potassium pump at the muscle tissue layer, and the uterus is a muscle. And so for it to work and contract more efficiently and all of this different stuff, I think it's very fascinating, interesting. It's all really new, but why not? I mean, if you're going to
Yeah.
be drinking some kind of an electrolyte anyway, that would be the one that I would recommend.
Yeah. Awesome. I didn't know that either. I'm gonna have to look into that. Okay, so how about setting ourselves up for postpartum? Because again, like I said, there's just like no knowledge, and it's like when you get there, you get there.
Yep, 100%. So my number one tip is to, if possible beforehand, either talk to a lot of women, take some kind of a course. I do have one that's coming out in September that's called the Immediate Postpartum Series, which I can give you more information about for your listeners. Read some books, try to prepare yourself for what is exactly going to happen. My course specifically is about the first 10 days. So it's all of the changes that happen between your body and your baby's body, establishing breastfeeding, the bleeding, the immediate postpartum interventions that happen to you and to your baby. So like things like the vitamin K shot, the eye drops, delayed cord clamping, the rubbing off of the vernix, the first bath, the hat and those swaddles. For you as the woman, it's placental contraction, fundal massage, Pitocin, prophylactically, how to manage the hemorrhage, the lochia, what's happening with your bleeding, what's normal with the bleeding, what's not normal, engorgement and sore nipples and nipple healing and first latch and all of their in that first 10 days, there is so much that happens. And after, not like after 10 days, it's easy, but it's just that you've kind of gotten through all this like huge transition and like your milk is in and like your baby is pooping and peeing and there's some like things that have kind of chugged along, and then now you're sort of just going to continue that forever. But that first little transition period is this is where I got really tripped up because I just could not believe all the stuff that was happening to me.
Yeah.
And there's a lot, so I want people to feel very like at least they've heard of it, at least they know what the word meconium is, at least they,
Right.
and then they can find a resource to give them a little bit more information or to know the very basics of normal and not normal so that they can just like lean into it and chill and have a really amazing, beautiful time with your little newborn and, you know, avoid some complications that were just because that you didn't know. Like it's a very sensitive window, as you and I know, for getting a baby established with breastfeeding. If something is happening in those first few days where it doesn't, you think maybe, oh, I'll do it in a couple days because like something. No, 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 no. You don't get, I mean, it very rarely does that work. There's a hormone loop that's expecting certain stimuli to happen in order to cascade things and in order for your brain to change and in order for that baby to learn. And we just need to know that this is like, it's going to be an intense time. You're going to get through it and then you're going to be
Hmm.
there. But how do we set ourselves up for the best success? So yeah, if you're going to read a book, something like The Fourth Trimester by Kimberly Johnson is great, but although that's more on like the healing of the mother and setting yourself up for a good postpartum, which is very, very important, but it's not as much about that kind of even closer, more immediate time period. So talking with other moms, taking some kind of a course like mine or other, I don't really know of another one that I can think of, but if there is something else, then we should link it because people need options. So that's kind of like the first thing I would say, is just don't forget about postpartum. It's so easy to know
Right.
everything about breastfeeding and then even to be really prepared for birth and then to be like, hey, then the baby's going to be here and then my life starts and it's like, whoa, whoa. There's a lot to know though about the baby being here.
Right.
So that's number one. And then number two is, this is just an easy tip, I think, to keep in your mind. It's not easy to implement, but is 4 meals a day for the first 2 months. So That's a lot of food. And now you have a baby in your arms, or maybe multiple babies under your belt that you're taking care of. And so it can be more difficult and challenging. So we need to do some preparation for this to happen, whether that's freezing a lot of meals in your last week of pregnancy, setting up a meal train. So like mealtrain.com, or I think it's called takethememeal.com. It might be bringthememeal.com, but there are websites that you can set up, or your friend can set up, your doula, somebody where like people can contribute. They can either bring a fresh meal to you, a frozen meal to you. People who live out of state can donate money for meal delivery services. It is such a game changer. It's so much more beneficial than like a
Yeah.
onesie or diapers. Well,
Right.
diapers are important too, but if somebody's wanting to spend some money and help you out, that is like such a gift. And you don't really know it until you're in it. And then you're like, wow, yeah, that is, because the demand of breastfeeding and recovery is far more than in pregnancy. So where is that going to come from? The fuel has to come from somewhere. And yes, people are eager to get their postpartum, or, their bodies back to their prenatal state. Just it will
Now's
come.
not the time.
Now's not the time. It will come, but you're sort of risking too not being able to make enough milk for your baby if we lose weight too quickly. So there needs to be a little bit of education and normalization around that too. And I know it's uncomfortable. I get it. And you want to be back in your body, and it will come, it will happen. But right now, our top concern is you entering motherhood feeling really good and replenished and repleting all those nutrients and making enough food to feed your baby for the long run. Which brings me into the third point, which is to know that these early weeks and months postpartum are sort of like the opportunity to charge your battery pack for your entire first year of motherhood. So resting and not, I'm sure that your audience is very familiar with the idea that like a lot of other cultures have 40 days in bed.
Mhm.
That's like a general tenet that we see again and again throughout human history and throughout all cultures all over the world. Long lion periods of rest where they're completely doted on and allowed to just nurse the baby and bond and recover. Here in America, it's really, really difficult to get women to even lay in bed for like 2 weeks. But if you can
Yeah.
commit to 2 weeks, you will be so much better off. And yeah, you might feel like $1,000,000. You might feel like you're going crazy in bed. I don't care. I do not care. You can sit in bed for 2 weeks and stare at your baby. These are 2 weeks you will never get back in your life ever again, especially if it's your first baby. You will never, ever, ever get the chance to just stare at your newborn baby and do nothing again. Just let yourself rest,
Yeah.
because this is what I see is like people will feel super good, and then they're in bed for 4 days, 5 days, and then they're up and they're back to their lives and they're doing whatever. And then they burn out at 3 or 4 months. Adrenaline is a tricky thing. It's very tricky. And especially if you have a long maybe you have like a heightened or longer sort of birth high with oxytocin, you may feel like better than you ever have felt. And it's a trick though. Like
Yeah.
feel it, enjoy it, like let it feel so good, like really revel in that, and know this is going to wear off. And if I have not been resting and taking care of myself, prioritizing food and just literally laying in bed, I'm going to pay for it at some point. And women always do. And then they regret it. And it's so sad to watch, because it's like, guys, it's no one has a crystal ball. So we can't see into the future, but I just really try to encourage women, prep yourselves, eat 4 meals a day every day, and stay in bed for at least 2 weeks. But just know that that's less than half of what we've come from in human history to know as the optimal resting period for a new mother. Like it's less than half. So it should be like a no-brainer, and it's still so hard for people. And what you're risking, and people are like, well, what do you mean? Like, what could I possibly, if I feel good, then who cares? What you're risking is getting mastitis, getting clogged ducts, losing your milk supply, bleeding again, postpartum hemorrhages because the scab inside of your uterus has, ripped open, fallen off, nutrient depletions, extreme, just energetic, your adrenal glands, your thyroid gland. So another thing to note about postpartum is that throughout human history, postpartum has always been recorded as a very huge opportunity to heal from things that you once had before you were pregnant. So pregnancy and postpartum are sort of seen in this like chunk, because I think now in our medical understanding, the reason we think this is because the immune system does this really big switch when we get pregnant so that we don't reject the fetus.
Right.
And in that transition back to our prenatal stage, back to that other immune system, um, setting, if you will, I guess it would be an easy way to think about it. There's a lot of chances to heal things like autoimmune predisposition, or even autoimmune disease that was like full on, or, there's all these stem cells that are coming from the baby throughout pregnancy and postpartum as well that could go and potentially heal organs that had damage, etc. And it's a double-edged sword, just in the way that it can be healing, it can be the trigger for
Right.
predisposition for things. So if
Mm-hmm.
you had a predisposition for an autoimmune disease that you had not yet expressed, and now you have a very exhausting or traumatic, or you didn't recover properly from this really big life event because of whatever reason, now you could be shunted into a different type of track for the rest of your life. And yeah, every time you have a baby, you have an opportunity for this healing to happen. But I just can't tell you how common postpartum autoimmune diseases are.
Hmm.
And it's like, it doesn't have to happen that way, and we're entering motherhood. We're entering one of the most energetically demanding times of our lives, for years and years, taking care of little children. And I think that there's so much to be learned and respected from the way that we came from. And so anyways, I know I'm just kind of talking in circles. I just really want people to know that, yeah, I get it. Some people feel really good. They feel really, really good, and they just want to go back to their lives, or they blame it on, I need physical movement to feel good. And I kind of understand that, but I'm also like, if you had back surgery, you would not be pushing yourself to go on
Right.
a walk at the
Right.
park or at the beach or whatever because you needed it for your mental health. Like, you would know, I really shouldn't. I really, really shouldn't. Like, I got to just rest in bed. And it's so easy for us to just override that. And I think it has to do with women, in the patriarchal culture,
Yeah.
and kind of
Mm-hmm.
being, yeah, overriding our intuition, like we mentioned earlier,
Yeah.
or being told that we need to be tough, and like, as if we're going to get some kind of like award for being out at the park with your 3-day-old infant. Like, no, just go home and sit down and be naked and be skin to skin with your baby and bleed on a Chuck's pad and leak milk everywhere, and just be present and be like, wow, this is a wild time. And I'm going to just like read them and weep, and like, have set up the community around me and my partner or my friends, my family, etc. Anybody you can, hired help if you have the resources, so that you can just like really revel in that, because it's such a sweet, sensitive, beautiful opportunity for so many different things.
Mm-hmm. Yeah. We just bought this freezer that I'm really excited about that I'm going to pack with postpartum meals. And
Good.
it has drawers. So I'm going to do like breakfast, lunch,
Oh,
dinner, like sourdough, like have like everything labeled and good to go. And I'm like, I cannot wait. My husband just got it yesterday to like start stocking it up, because I'm
beautiful.
like, I know that
As
I
a
need to
third baby
rest.
too. Yeah.
Right. And then you have other kids. So it's like, unless you have stay in home help who's going to be up, like, unfortunately my husband doesn't have a lot of time off, so when he's
Yep.
gone for work at 5:30 in the morning, my kids are up at 6. If
Ugh.
somebody else isn't here,
Yep. Yep.
like, then that falls on me. So but that's also where I'm like, here's a banana and some cartoons.
Yes, exactly. Yeah. And that's another thing, is like letting go of these kind of acute periods of time
Yeah.
that things may not be exactly held perfect with your other children if you have them.
Right.
And that's okay. A lot of people I know, like, especially in this world, who are maybe in the kind of natural motherhood type realm, might be really hard on themselves about that with screen
Right.
time and like with what,
Yeah.
what? No, we just
Yeah.
have to relax. It's not going to melt their brains. They're going to have many years of their adult life where they're watching screens. And I get it as kids. Yeah. Okay. But you know what? What is more important? There's a risk benefit ratio to every single decision that we make. And for you to be able to have a stressless and easy, recovering, restful, deeply nourishing postpartum, you just got to do what you got to do.
Mm-hmm. You got to let go.
Yep, exactly. Just like you did in birth, you have to let go about a lot of stuff. I
Yeah.
actually was talking about this with a friend the other day, that I think that women who are very, very type A or perfectionistic, like have perfectionism type struggles, people pleasing struggles, and control issues, have the hardest time in motherhood because of all of the various ways that we have to just be like, and I mean, that was me. That was me in every one of those ways. I was totally a perfectionist. I was really hard on myself, not because of anybody else, but because of my own standards for myself.
Yeah.
And I like am a totally different person now after 3.5 kids than I was, and much better for it.
Mm-hmm. Yeah.
Mm.
Yeah. I know. For me, it was probably more people pleasing. I don't think I'm like type A. I'm not type A at all.
Good.
I can be a perfectionist with some things, but for like the most part, no. But definitely the people pleasing, the Enneagram 2 in me
Oh
was
yeah.
very much like,
Yep.
Liz, stop.
Yep. It's hard. I'm an Enneagram 7, so I'm like, where can we have fun with everything? And sometimes not grounded in reality with that.
Yeah. Yeah. Did you have any other postpartum tips for us?
That's what I got.
Perfect. I
Yes,
love
hopefully
it.
it's helpful.
Yes, very. I love the meal train idea. I always tell people that too. And I always tell people as well, it's like, if you're bringing a meal to somebody, leave it at their door. Like,
Yep.
don't, I mean, especially in those first few weeks, but even like in the first couple months, it's hard and everybody's so different. Cause I know for me, like, I had my first baby in the middle of COVID. So we were like, what are we supposed to do? Like
Yep.
winter here, and then because of COVID, the next couple years, viruses were crazy.
Oh, they were horrible
Yeah,
because
even this
nobody got
last year.
anything for years. Yeah.
Right. And so now I'm having my baby probably Thanksgiving week, heading into another winter. So
Ugh.
I'm like, I'm gonna be like psycho about like, do not kiss my baby, do not, you know what I mean? Like, and
Yeah.
probably, I don't know. I don't know what the right answer is because I want them to build an immune system and not get sick all the time. But also, I don't want a bunch of people coming over, my baby being passed around
Yeah.
during virus season. And,
Yeah,
so I'm
not in the
like,
first 3 months. They don't need to be exposed to anything ideally in the first 3 months. I mean, it's going to happen, when you have older kids, but still it's like
right.
there's just such a sensitive period there. And even I feel like I'm we barely wash our hands, we barely take baths, etc. type person. But
Yeah.
in that, I do really have a lot of respect for that first early infant period. It's like just not something to take the risk with because I don't really see the benefit either. Because when you are breastfeeding, the maternal antibodies in your breast milk will often neutralize any antibodies that the baby is being introduced to, anyways, because of the way that it just works inside of our bodies. So, like, for instance, the Tdap vaccine, this is an interesting one. We know very much. So, a lot of people will get the Tdap vaccine because of the pertussis aspect of it. But at 2 months, when it's given in the first dose, the pertussis antibodies that would be theoretically made by the baby if the woman is breastfeeding are completely neutralized and invalid at that 2 month shot. It really should just be given at 4 months. That's where the baby could be protected from pertussis, in that way. But the 2 month one, like, we know that it doesn't really work all that much. It's still part of the schedule. I don't know. It's an enigma to me, but
Yeah.
there's lots of things don't
I
really
didn't
make
know
sense
that either.
sometimes.
Oh, I mean, tons of things don't make sense to me.
Yeah. Yeah.
Especially being in the birth world. I was just having this whole conversation with my husband last night, but we won't get into it.
Yeah.
Because it's constant with me.
Yeah.
But yeah, that's interesting. I didn't know that either. Because that also is like when pertussis is the most dangerous for a baby
Yeah.
is in those first few months of life. I think like the first two, and it's like they don't even get their dose until 2 months. But if you're
Yep.
breastfeeding, it doesn't even matter. So
Until
it's
like that.
like,
Yeah. At least past 3 months. It's that first
opens.
3 month window where it really just doesn't. And then, like the idea of getting it Tdap in pregnancy so that you could give the antibodies, that does make theoretical more sense, but it's not been tested safe in pregnant women.
Right.
So we can't be recommending that because we don't actually know the safety of it. Although theoretically, when we think about physiology, it would make the most sense. What would make the very most sense too is just for people to have had a baseline exposure to it. And it's something that we carry forever in the rest of our lives, like, having wild type or some level of exposure, because then you'd have the most robust, I mean, whatever. Now we're getting into immunology, but you'd have the most robust long-term antibody profile.
Right. Yeah, for sure. Well, for those listening, before we wrap up, where can they find you, follow you, work with you? I know that you're constantly doing like workshops, webinars, you have so many resources. So how would somebody be connected with you?
Yeah, thank you. So my Instagram is just my name. It's Morgan MacDermott. MacDermott is MacDermott. So that one trips people up a little bit. And then my website is called milkmedicine.com. So that's sort of where I'm caching all of the resources and keeping them available to people. So because I'm about to go into my 4th maternity leave here for a while, I'm in a big push right now to finish a couple of things. So I just started a pregnancy call that is going to be like a future thing that will be 6 weeks live, led by me, all of the top information that I think is relevant for pregnant women to have an optimal, healthy pregnancy for themselves, their baby, and then also prepare for birth, breastfeeding, and postpartum. That is a continual program that I will run again and again, but I'm only doing one run before this baby comes. I think the next one will be early 2024. And then that immediate postpartum series course that I was referring to earlier is going to be coming out in September. So that's something to look out. I also have a mastitis ebook and a natural cold and flu care webinar for people who are wanting all of my top tips for the naturopathic remedies to use for when your kids get colds and flus in the wintertime or any time of the year, really. But it's from newborns on up. And so even little tiny babies like we're talking about in here, and this is where homeopathy comes in, like we were mentioning earlier as well. Homeopathy is completely safe in breastfeeding newborns. The first day of life, you can give homeopathic medicine to a baby. And so it's a really wonderful one, but it's very confusing for people. So I try to teach them, what are my top remedies for various illnesses and how to use them, et cetera, along with a lot of other things, herbs, supplements, home remedies, et cetera. So that's kind of like how those two areas. And then I have a podcast that I co-host with my best friend, Dr. Leah Gordon. It's called Healthy as a Mother. And it is from the spectrum of becoming and being a mother. She focuses on the fertility, preconception, trying to conceive, and IVF support. I do the pregnancy, birth, and postpartum stuff. And so we're about to enter season 3 and it's super fun. So we go back and forth each week is one of her topics or one of mine. Sometimes we have guests. It's really fun. So I guess those 3, Instagram, the website, and the podcast.
Awesome. I'm going to link all of those notes I'm going to put all those links in the show notes. So people will be able to find you very easily. I just want to thank you so much for coming on, and having this conversation. I do feel like so many people are lost with even what to do. And it's like, maybe take a second, take a breath. How do you feel? Like, what's your intuition telling you? And I love that we touched on that too. So I just want to thank you so much for coming on the podcast. Oh, one more question. Since the podcast is morning Hava, how do you take your morning Java? Do you drink coffee?
Oh, I do. Ooh, this is a controversial one, actually. Okay. So we raise chickens. I live on a property in Idaho and like a little family compound. And so I put in a raw egg yolk. This is the way I make my coffee every morning. A raw egg yolk, the kneaded collagen powder, which I love because you can't taste it at all. And I am so grossed out by all other collagen powders that I've ever tasted, but
or protein powders.
Yeah,
I hate all protein powders.
Protein powders, but specifically to just collagen powders, I feel like are always really gamey and that kind of weird, gross taste. It makes me want to vomit. Like, honestly, even thinking about it, I can barely talk about it right now. I can't. But the kneaded one is so good. And as we know, it's so clean and pure as well. And so you don't have to worry about the heavy metals and all the different controversies. But so I use the egg yolk, the kneaded collagen powder. I do a big, huge scoop of grass-fed butter, a bunch of Redmond's real salt, and then some maple syrup. And so in the coffee, there's like 22 grams of protein and like about 20 grams of fat as well. And I just blend it up with an immersion blender in a cup of coffee. So I just drink 1 cup in the day and it makes me feel so good. And it's the best way that I start the day, because sometimes my kids wake up at different times. So I drink that first. And I know a lot of people are like, eat food first. I feel like my coffee is sort of food as well because of all the other things that are in it. If I was just to drink black coffee, I would say, let's eat some food first. But anyway, my kids kind of wake up at different staggered times. So I'll make breakfast once they're all up, but I have that coffee first and I just freaking love it. I think it's amazing. And I use the raw egg yolks from my chickens. I feel really comfortable with that. Even in pregnancy, I wouldn't feel comfortable with it with a conventionally raised chicken egg. They do a bunch of things to them. I mean, they're not eating the bugs and the sticks, or not sticks, but bugs and seeds and things that they should be. But then also they process that, they wash the eggs off, which removes something that's called the bloom, which is a thin membrane that dries on the egg when it comes out of the chicken that fills in all the little pores of the egg and it prevents bacteria from getting in. And I know that my chickens are clean and, I take care of them. So I feel really good and comfortable about this. I would suggest with other pregnant women, if you want to try it, to get eggs from like a local farmer or a friend with backyard chickens so that you can do the same. And really give it a shot. I know it sounds weird. I swear you cannot taste the yolk, but the key is you really can't. Oh yeah. Have you tried it?
I pretty much do that every day.
Okay. Isn't it so good? I look forward to it.
The froth is like,
yes,
it's like a latte.
Yes. And there's no
So
milk.
good.
It's amazing. And people, I think, are so skeptical, and I totally understand why you're skeptical. Just give it a shot. But the key is the immersion blender. You cannot just use one of those little like whiskey, electric powered, like coffee ones that's like a normal frother. No, you need an immersion blender and it'll change your life.
Yeah. Yeah. It's so good. When my husband's home, like, cause he wakes up before I do. So like on Sundays, I'll make him one too. Um, they're so good.
Oh,
But
so yummy.
yes, big fan. I do everything the same. I do actually add a tiny bit of raw milk in mine.
Oh, and a lot of people like that. I often don't have the raw milk. I want to actually, you know what? Next summer when this baby is like 9 months old, I want to get a milking cow.
Yeah. Yeah, that'd be fun. And
Yeah.
a lot of work.
And a lot of work. I know. I hear from people you can get one that has an older calf that is maybe needing only to be milked like once a day, kind of like how humans are when we're in the weaning process and you just are making so much less. So that the idea is that we would milk her just like once a day and get, 2 gallons instead of twice a day getting like 5 gallons because nobody
Right.
needs 5 gallons of milk every day. It's ridiculous.
Right, right. I mean, my aunt and uncle went through that because they had 7 kids. And I have a cousin, I was just talking to him, not this last summer, last year. He's 6'9". And
Oh
I'm like,
my.
growing up, he drank a gallon of milk a day by himself.
Oh
So I'm like,
God.
and sometimes close to 2. So I'm like, you drank that much? He's like, you don't get this big not drinking that much
Yeah.
milk. I'm like, holy crap. This guy is
Wow,
a
that's like a
giant.
job. He must have had some kind of like alarm clock going on. Like, okay, drink another 8 ounces, drink another 8 ounces. I
Right.
mean,
Well, I mean, we haven't gotten to like that season of life where our kids are like, you hear about it, like that
yes,
teenage boys are just like,
eating so
yeah,
much. Yeah.
right, right. So it's like at least like drinking that was like fulfilling some nutritional needs
Yes,
versus like just going
100%.
through snacks and snacks and snacks.
No,
But
I love it. Raw milk makes me feel so good. I drink it in the middle of the night when I wake up and I'm hungry. I don't know if that's happening to you, but I just cannot, I can barely make it through a whole night still with sleeping and not having to get up and eat. So
yeah,
obnoxious.
yeah,
But
that's never really happened to me for some reason. Like in all my pregnancies, I put on like all my weight the first like 25, 30 weeks, and then I hardly gain anything toward the end. Cause like what I was at 25 weeks pregnant was what I was at full term with my other two. But like
wow.
that's like how I did it with them. I put on all
Yeah.
my weight like toward the beginning, and then toward the end I taper off significantly. And so I'm not in the first trimester, I'm starving. So like when
Yeah.
they tell people like, oh, you might not be that hungry, you're in the first trimester, I'm like, no, I'm hungry. I need
Same.
snacks. But I think I do need to be better because sometimes we'll eat dinner at like 6 and then I'm not eating till like 9 the next morning. So
Yeah.
like I need to be better at like, okay, yeah, just drink a glass of milk before bed or something right when you get up type thing. Cause I know
Yeah.
that
For your blood sugar for baby to have
right,
some consistent nutrients. Yeah, for
right.
sure. I know it's really interesting how that changes. I was deep diving into gestational diabetes for this pregnancy call that I'm making. And there was just some things that I didn't know about the way that insulin works in pregnancy and how it was just kind of fascinating. The idea that insulin will increase like 15 times in the first trimester. So people's blood sugar is
Yeah.
like all over the place, which is partially contributing to the nausea because when you're hypoglycemic, which is when you have low blood sugar, you're going to feel more nauseous. That's just the thing that like normal people who aren't pregnant feel as well. So then it's this chicken or the egg. It's really hard to get on and stay on top of. And yeah, in the first trimester, I'm sometimes up like twice a night eating. I'm like, I cannot get enough. I'm like shaky and weak and freaking out if I don't eat at all times. And it does level out because that insulin sensitivity goes down as you become more pregnant. So that would make sense too, as you're gaining a lot and then you hold up fast and then everything becomes a little bit more stable. Your blood sugar is more stable longer and you don't have to be constantly eating. And so then you're probably not taking in as many calories. So you're more just like taking in what you're burning and everything's pretty much level. Even though baby's gaining weight, it's still coming from, anyway,
Right.
I digress.
Yeah. Yeah, totally. Yeah. It's just interesting. And we can like wrap up with this. Just, I mean, just again, like in the medical system, that like everything is kind of put into one lump. It's like, this is how
Yep.
your pregnancy should go. Like by this time, you should have gained about this much. And about
Yeah.
like the whole pregnancy weight gain is just like a huge trigger for me, like in general. Even when I see like posts about it, that's like, you want to know what the 30 pounds of pregnancy makes up? I'm like, 30 pounds? I've never gained 30 pounds. I'm like, I've always gained way more than that. And
Yeah.
I'm a pretty healthy pregnant woman. Like I'm
Yeah.
not somebody who eats a bunch of junk or anything like that. I really try to nutritionally take care of my body.
Yep.
And so it's like, it's just like, you hear the women who are like, my doctor told me I'm gaining too much weight and all these, and it's like, you
Oh, it
don't need
makes
that
me
stress on you right now.
no, you know what I'm trying to do this pregnancy? I'm trying to gain 65 pounds. That's my goal. I've gained 43. I'm 30 weeks and I've gained 43 pounds right now. I'm trying to get 65 because I know what happens to myself postpartum. And breastfeeding just if I lose weight so quickly, it's so energetically taxing, even though yes, I am trying to do all the eating and everything, but I have a very fast metabolism. And so I am like going for it. I'm going so hardcore on this particular one because you know what happened to my third pregnancy, which was during COVID and it was during a big move for us. I think I wasn't paying as much attention nutritionally. I was just distracted by the world
Yeah.
falling apart. And I only gained like 35 pounds with her. She was 2 pounds less than my first two kids, where I gained about 45 pounds each. And they were both 9 pounds, 3 ounces. She was only 7.5 pounds. And then I lost that weight so quick. And it was like such a battle trying to stay feeling good because I would just get too thin. And then, I would eat more food and I would just make more milk and it wouldn't
Yeah.
really go to me. It's like
Right.
something happens in my physiology during breastfeeding where it's bypassing my body and it's going
Right.
into the milk. And not until I would wean would I actually start to gain weight back and feel like a
Yeah.
normal person. I can get skeletal like very quickly. And that's not good. People, because our society's all screwed up, everybody's like, wow, you bounce back so fast. And I'm just like trying to kind of sound the alarm, like, that's actually like not good. It is
Mm-hmm.
not vital for our bodies to be too thin, especially as women. We need fat stores for all of our hormones to work efficiently, for us to feel really good, for our thyroid to have good function. We need it. And I don't know, it's just like another type of metabolism that can happen where you can lose it quickly and it's too much. So anyway, I'm trying to like get ahead of that by an
Yeah.
additional 20 pounds and see if I can. I don't know, it's a big experiment. I'm not worried about, I mean, it is weird, obviously, to be in this body that is so much bigger right now and expecting it to even get bigger, but I just am really not tripping out about it because I know it'll change at some point, you know?
Right, right, yeah. That's how my sister was. She would get too skinny, and then she'd have health issues, and then when she
Yeah.
was done breastfeeding, she's worked with, um, like, nutritionists, dietitians to gain weight, to keep healthy weight on because same thing, she always had great milk supply, but it was like whatever she'd eat would bypass her, and just, like, she was smaller than she'd ever been in her life breastfeeding,
Yep. Yep.
and it wasn't healthy.
No.
So yeah, I mean, everybody's body is so different and everybody's needs are so different. So again, that's where it's like we need the
Individual care.
totally, totally
Yep.
with all of it. And that's how labor and birth go too. It's not this perfect rhythm of contractions. It's not this perfect
No.
flow of the Friedman's curve and that you're going to dilate this much in this amount of
Yes.
time.
Yes.
That's why you have to surrender to it. You have to like be open to how your birth is going to go because again, letting go, like it's not in our control. Control what you can, let go of what you can't, and be present in it because everybody's labor is going to look so different. But when you're
Yep.
in a certain medical model, they want things controlled and to look the same. So you have to,
Mhm.
excuse me, be able to know this information for yourself, be able to advocate for yourself, and to know when maybe something is off for yourself um, versus, people always
Uh,
telling you like your weight's too
yeah.
much, this is too much, we need to induce you for that, we need to whatever. It's like, okay, step back.
I fully agree. I know. I feel like what we're, in the medical revolution of the early 1900s and late even 1800s, it's like where we've come. Yeah, we've made huge leaps and bounds, of course. And I think we're like in history, we're going to look back and be like, wow, we were so methodical and so patternized. And we were like, this is how it has to go and flow. And then eventually, hopefully now, and we're on the cusp of that and entering that and going to stay in this is that,
Right.
oh no, actually, okay, that was our understanding because it was all new and we needed some kind of
Mm-hmm.
box to put it all in. And now we understand it. We can realize, oh, the box is actually like a dotted line and there's a lot of flow in between. And it's just like really individual. And how do we manage that? And how are we training practitioners? It's hard. I mean, I get it. It is really hard to know that every single patient or client that I work with is a completely individual person and has all these different factors, and like something that I maybe had done for somebody else isn't going to work on them. And it's this like
Right.
art and practice and science, and it's tough. And you have to have a lot of mental energy and fortitude to want to do that. It's much easier to put people in a box, say do this, do that. I don't have to think, I don't have to use my brain cells, and keep it as if we're like a factory or something like that, like AI, which I mean everything's moving that direction anyway, sadly. But we have to remember that it's not that way.
Right, right. Totally, totally. All
Anyways,
right, we'll wrap this up.
yes, thank you for having me. This was
Yeah,
awesome.
thank you so much for coming on the podcast, and I'm excited
Yes.
for everybody to hear this. This will probably come out when your postpartum course is out, so make sure that you get me
Wonderful.
that information
Okay.
so I can link it in the show notes and everyone will be able to find it really easily. But thank you so much.
Woohoo!
I'm
Thank you.
excited to see how your fourth birth goes.
Yay, me too. Thank
That's
you.
so
And you as
exciting.
well with your third.
Yes, I'm excited. I'm excited to give birth again.
Me too.
So it'll be fun. All right. Thank you so much.
All right, bye.